I entered the service just before we began building up for Panama in November of 1987. In 1993, I was injured in an accident on Fort Bragg. The literal last thing I remember was exiting the aircraft, and it was so bright, and you could see your boots, and I think I was thinking at the time, I'm so happy I get paid to do this. This is an awesome thing. The next thing I remember, I was trying to get up, and my first sergeant had rushed over to me and was telling me to lay still and just trying to be still. Grand mal seizures, for me as an individual, start with kind of a visual warning. It starts out in the upper right quadrant of my eye, and I always wiggle my fingers, but really what's happening is that my vision begins to fade, and what I get instead is a flicker, like if you were staring right into a strobe light, like think in a nightclub, except that it's small and then it's bigger and it takes over my field of vision. If this is my field of vision disappearing, this is the halfway point. And then right about here is where I would say I no longer am fully conscious. I might be able to talk to you, but when I lose vision in this eye, I won't remember anything else.
The biggest thing that I hear from people living with epilepsy is the loss of control that they feel.
There are a lot of issues that go into epilepsy and being unconscious suddenly, and people not being familiar with what's wrong with you. I've been restrained by the police who thought maybe this was a drug thing. I've been robbed. If I have a seizure, my bike is staying wherever it is. Sometimes that means it gets stolen. I've had 4 bikes stolen that way. 4. It sucks. I lived in denial for a long time about how dangerous it was to drive. When I first got out of service, I kept driving. I think I bought a motorcycle. But then I had a series of accidents. You might even say they escalated in severity. The worst one happened, it was the thing that caused me to stop driving, was I had that motorcycle and I had just gotten onto it and I was getting ready to go, I think 6 blocks. I was gonna go help a friend babysit. I got onto the motorcycle and then I woke up and they were lifting the motorcycle off of me. I think what had happened was I began to have the seizure. I didn't have an oral warning, and my hand just pulled back on the throttle, causing the motorcycle to spin from under me and land on my leg. I could have been in a car driving, or I could have been in front of a crowd of people. That's what I really kept thinking about. Relatively, I was all right, embarrassed more than anything else, but it could have ended so badly. I would say that not being able to drive is a very, very big deal. It limits you in a major way.
Having to learn a bus schedule, rely on others, sort of further stigmatizing them as being different from those who can freely drive as they please, I think that's a major toll on independence.
So you can't operate power tools, you can't drive, you can't climb ladders, you can't lift items way over your head, you can't be anywhere where you're in charge of the safety of others or where you can impact their safety. Most infantrymen fill jobs that are just like that all the time. Construction workers, security guards, police officers, firemen. Literally, the fields are littered with former servicemen from the infantry community. I can't be part of that community even as a volunteer. So it's been very difficult work-wise. I've been unemployed for a long time. That's how we form our core identity, at least in this culture. Who are you? What do you do?
So they do lose a sense of self-worth and confidence.
People with epilepsy often have issues with anxiety surrounding when they're going to have a seizure, restrictions that are put on their recreational choices, and this can impact their sense of independence and their quality of life.
I used to surf, and I had friends who would go with me, and they were like, if something happens, you'll be fine. And then there was an incident where one of them broke his collarbone. He broke it and he was near the beach, and I was out on the waves by myself. It's harder to have equal social relationships. There's a bit of a people who are my peers and friends become transformed into sort of semi-caregivers, and spend their time wondering whether if I'm late, they don't know whether I'm just being flaky or whether I'm suddenly missing somewhere in the city. It's stressful. I was when I talked about that motorcycle accident, I was on my way to help my friend. And initially she was really angry because I had promised I would come help her, and she had a newborn and she just needed some sleep. By the time she found out about the motorcycle, she flipped from being angry to really overprotective. To the point where they didn't want me to stay in my apartment by myself. And that kind of stress in a relationship is it's almost intolerable.
Luke has admitted that he has anxiety and depression, and he has been actually received treatment for that for quite some time.
Although a majority of individuals diagnosed with epilepsy do have good seizure control, I think that there's often that anxiety of when the next seizure might occur.
It was killing me. It was I want to say it was worse than the seizures themselves. I was living in constant fear.
I think that it's normal that with a new diagnosis of epilepsy to feel a sense of loss.
I've been seriously depressed. I've been suicidal. It's to lose that core identity as to who I was. That not everybody can make that transition. I've spent months in the hospital trying to get stable.
Depression is often a lifelong struggle, and reaching out for help and finding the treatments that are needed early in the course of epilepsy is usually the best way to keep that in check and more manageable.
I think the first thing to do is to get into therapy. Get into therapy and just begin talking about how it's changing your life and what it means.
It's important to know that it gets better, and that there are many people that have faced the same fears and challenges that you have faced, and it does get better.
I have much better control than I had when they first started. I have better control than when I first arrived in Portland. The medications have changed. Different techniques that people have tried have helped.
Luke finds ways to stay busy. He interacts with people as best he can, given his challenges.
I kind of had the quest to find work, or even just to volunteer. I have had some volunteer things that I've done instead. I've learned to be a pretty good bike mechanic, so you can stop in and I'll grab a wrench and wrench on your bike, and unless it's something unusual, then I can usually get that done. That's a good feeling. And recently I've done some volunteer work as a page with the library, where I place books on shelves. In essence, I had to find a work environment where if I became ill, the impact would be minimal.
I think that Luke is a very intelligent, inquisitive, and positive individual. And I think his positive attitude has really helped him through a lot of difficult situations.
I always look for new things to try to do, to, I guess, push back.